is acute and critical care equipment devices used with the cardiovascular and respiratory systems. So I have some of the equipment here with me today, and we're gonna be filming each and every device, and I'm gonna give you kind of just a generalization of what we should be looking for and what we might do or interact with them as physical therapists. Okay, so our first device is going to be our IV line, which you see behind us. And the IV line is used for the infusion of liquid substances into the veins, and that could be peripheral or central, which we'll get into the catheters later. But what we should know is that when we ambulate our patients, we should be taking this pole right along with us and not disconnecting the lines. Our next device is a pulse oximeter. So we've used different ones inside of lab, but this one, as you can see, is right next to the patient, and it's going to be hooked up with also the temperature and the blood pressure cuffs. So the pulse ox, as we know, is a device that measures the proportion of oxygenated hemoglobin in the blood. This one is going to be used right on the finger, but you can also see them on the ear or even on your toes. Our next device is our blood pressure cuff. So as you can see here, again, this is just an automatic one hooked up to our machine. And the blood pressures, as we know, are going to be measuring the systolic and diastolic pressure and from the heart. So you should be very familiar with the different cord cuff sounds if you do a manual, but this one's going to give you a direct reading, systolic on top, diastolic on the bottom. So now we're going to talk about some of the catheterizations that would go with those IV lines that we talked about. So right here we have the peripherally inserted centrovenous lines, and they have different sizes, as you can see here. So again, same thing with the IV lines. You wouldn't be taking those out. Right here, as you can see, we also have a port A cap. And those are going to be totally implanted actually in the chest. So I don't know if you remember from Respiratory's class, but if you see those coming out, if any way, we're just going to notify the nurse to get those back inserted. On the patient behind me and in my hand, what we have here is a tunneled central venous catheter, also called a Hickman. So as you can see on our patient, it's actually inserted right here, feeding right into the heart and the veins. So again, just like any of the catheterizations and IV lines, we never want to take those out, and if we see them coming out, immediately notify the nurses. The next device is going to be our cardiac leads. So you're going to see these placed on the patient, and so these we're not actually going to be removing before ambulating our patients, but you will see the actual cardiac monitor, and the leads and the wires themselves are going to be these guys. They're going to be hooking up, and so all you're going to literally be doing is kind of disconnecting it right here. Turn off the monitor so it doesn't beep. Obviously, we're going along with all the precautions to make sure everything is safe, but you will not ambulate the patient when they're hooked up to the monitor. It's going to be going right into the wrist, measuring pressure. And the second one is the pulmonary artery catheter. You would typically see this just like you saw the tunneled central venous. So our next two devices that we're going to talk about are SCDs and TEDs. SCD right here being sequential compression devices. So you're typically going to see these on your patient's legs hooked up to an air pump right on the hospital bed itself. And what it does is going to be just sequentially compressing the legs, and that's going to be for the prevention of thrombosis. You don't want to ambulate your patients with this. So they're in the bed, you're about to ambulate, you can take them off. What you'll typically see underneath though is our TEDs. So TEDs is just another garment, again, to prevent embolism in the lower extremities or arms, wherever they may be. Just one precaution you might want to remember is you don't want to ambulate the patients when they have these on legs. You don't have to take them off, but you do want to wear slippers or non-slip socks for the hospital. So the next device is a typical face mask that we use like in class, just to prevent bacteria getting in your mouth. Our next device is a flow meter, and you're going to see it right behind me on the wall as well. But the flow meters, there's typically two colors, green being oxygen, yellow being air, and it does have a ball right in the center. And what that's going to be measuring is the O2 liters per minute, and you want to make sure, based on your patient, it's exactly where it needs to be. So that's typically going to be hooked up to an oxygen mask or nasal cannula to supply oxygen to the patient. And what we have right here is our nasal cannula, again wrapped around the patient's head and feeding into their nose. Then we have the actual face mask that they might be using in lieu of it. This device right here is called a partial rebreather. As you can see right here, there's a disc on it to prevent the patient from kind of breathing in their own oxygen or CO2. So this is partial because it has one side, and then they have a non-rebreather will also have both sides. This next device is from a nebulizer. Obviously, you would have a nebulizer machine itself hooked up with one of these lines, and typically they'll have a medicine inside, typically albuterol, and they're going to be having like a nebulizer treatment inside, a lot of times inside their bed. So with these guys, you just want to wait till they're finished, and then you can ambulate after. Next, we have two types of trach tubes. We have the tracheostomy tube right here, which is going to be kind of using their own windpipe. It's going to go down the mouth and through the trachea. So you definitely would not be ambulating the patient with that. And this is an endotracheal tube. So it's going to be used to create a windpipe right inside the throat. Again, you can ambulate with this one, but using all your precautions. So the first device we're going to talk about right here is a ventilator. So what you see behind me is the ventilator machine that the anesthesiologist would use. In a typical hospital room, this is used in the OR. In a typical hospital room, it'll be toned down a little bit, but you still would have your patient here incubated with a trach tube, just like we saw earlier. That trach tube would then be connected to our air oxygen tubes, just like you see here. You see in a typical room. The other device I have here is a portable oxygen tank. So this is not in a carrier, but obviously, and when they're on like a nasal cannula or things like that, and you are able to ambulate them, you would be using a portable air oxygen tank.